This conference will now be recorded.
Hi, Michael.
Hey, Brian, how are you?
Good. How about yourself?
Doing well, thank you.
Good. Thanks for taking the time to join us. I know you're busy today. I know it'll be very much appreciated by all of our membership and all of our colleagues that you're gonna talk to us about things the last 6 weeks. And for those of you who don't know, Michael Nail is the commissioner of the Georgia Department of Community Supervision. In a pretty big state. I think Georgia's between around 10 and 11 million people.
Yep, that's correct.
Yeah. So, I guess to get started, maybe you could tell us all a little bit about the Department of Community Supervision in Georgia and kind of your footprint.
Yeah, certainly. And again, I appreciate the opportunity. We were created back in July of 2015. Prior to that, felony adult probation was under the Department of Corrections, and then parole supervision was under the State Board of Pardons and Paroles, which is a separate state agency. In 2015, those probation and parole supervision merged to create the Department of Community Supervision. So we currently are responsible for all adults under felony supervision, whether they are in a probation or a parole status. We right now have just over 200,000 under our supervision. Unfortunately, we lead the nation in the number of cases, and unfortunately, we also lead the nation in the length of time someone is sentenced to probation. So we've got certainly unique challenges, but by combining the two entities, we've created a great deal of efficiencies and seen far better outcomes. So that's a little bit of the landscape. We cover, of course, statewide, over 200 Superior Court judges, 5 members of the State Board of Pardons and Parole who are responsible for release decision making. So that's really gives you the lay of the land. We have about 1,500 sworn staff, and what we would just right at about 500 non-sworn staff. That would include administrative staff, counselors. So right at just over 2,000 on the sworn staff. So that gives you a little bit of the lay of the land of what Georgia looks like.
Yeah, no, it's big operation you have, and I think a very smart move on the state of Georgia's part to really combine probation and parole to felony levels to one supervision kind of entity. We've honestly seen nothing negative from that. At all. Yeah, no, I mean that's a really smart thing, and that's a lot of cases. That's quite a lot of supervision your officers are taking care of across the state. So,
yep.
And I imagine the past 6 weeks or so must have shown some challenges, I'm sure, with the pandemic and all. How have things kind of shifted on your end?
Go ahead. I'm sorry.
Oh, no, I was just finishing up. Sorry.
Well, I was going to say that I don't think we're not experiencing anything different than anyone else, and that's first and foremost. I think the second thing is nobody had a plan for this. How can you plan for something that has never occurred? That's extremely difficult to do. So that was one of the biggest challenges, is suddenly pulling together, formulating a plan, communicating that plan, and still staying focused on carrying out your core mission while you're looking out after the safety of your staff, and also making sure that those that are under your supervision are informed. We've seen some good things that have actually come out of this, and some things that we're tracking that we hope may be a change to our service delivery model. But it has really become the focus of what we do. And I think first and foremost, we had to start prioritizing on who's going to get the services, what level of services, from reporting to field contacts to staff safety to interaction. We were fortunate. We have made significant strides in our technology delivery. So we switched to more of most of our jurisdictions work off of a virtual model. They don't even have an office that they go to. And by leveraging technology, we could easily incorporate a larger number of video contacts. So that was one thing from the supervision arena, is relying on those video contacts. You've got to look at your office operations of the offices that you do have. How often does somebody need to be in there? We had to modify our office hours. We had to get special exception from the state to run counseling groups where we could do telecounseling, and had to get staff spun up very quickly on telecounseling, where these individuals could still remain in their counseling and their treatment, albeit not face-to-face, but certainly through electronic means. So a lot of moving pieces, very, very quick, that had to be in place. And I'll tell you, Brian, one of the biggest things that I've been just most proud of, aside from our staff and the way they have received this, but the various networks throughout the nation. When you look at networks like NAPE and APPA, and you look at National Institute of Corrections, and everyone leaning on each other to find what we believe is the best way to continue doing our business. That's what has been most really gratifying, is to see kind of the esprit de corps, like we're all in this together, and we're going to work together to find the best answer and the best service delivery model, and bouncing ideas on a daily basis, literally, back and forth has just been wonderful to see. So you've got the operational plan, and then you've got also the leadership component of it. I know from my responsibility as a commissioner, I've got to ensure staff are safe. I've got to ensure that they feel safe. I've got to make sure that we over communicate. This is not the time to assume people know. So the over communication is a key. Also, one thing that we did is identify one person to be responsible and a point of contact for this pandemic. And that is one person that is a go-to, that's filtered, that when people see an email coming from this individual with updates, they know that that's what it is dealing with. So that was just for starters, I think. And then again, making sure those we supervise, that they understand the seriousness of this. They understand why we're changing our business model, that we understand how it will impact them. We took steps, just like many other states, where we really stopped pursuing technical violations. For those that were in jail for technical violations, we found other ways of, instead of waiting in jail perhaps for a hearing, to either do waivers or to hold the technical violation in abeyance. But being in jail was not really the best place for them to be at that time. And we've got a responsibility, certainly with our sheriff's departments and our jails, to not compound the problem. That doesn't mean you don't address issues as they arise, but when it comes from a technical violation component, we have significantly backed off of that. I had to modify our drug testing protocol. We started with basically saying we're going to suspend drug testing unless it is for a significant cause, and then it has to have the chief's approval. And so those are just things that you really they just hit you, and you really get not given a lot of thought to it. And So again, relying on that network and various resources to determine what is probably the best way to go about this, communicating those changes. We put in place rather quickly a 3-phase operational plan, and we started out with a phase 1, and then as the situation progressed, we went to a phase 2. And fortunately, at this time, we didn't have to go to a phase 3 because the phase 3 had a lot of unknowns in it. You couldn't write the plan for phase 3 based on unknowns. So right now we're in our phase 2. Things are starting to return a little bit back to normal, but there's still going to be some continuation of the changes. But from an operational standpoint, that in a nutshell is what we have been dealing with. And like I said, it's not really any different than anyone else throughout the nation has been dealing with. I think it's just everybody relying on one another to find the best way and the best resources to make it happen.
Yeah, no, for sure. Yeah, operationally, how is staff it sounds like you were kind of utilizing technology in a good way anyhow in Georgia before, the pandemic, but, I'm sure you're kind of utilizing it even more so now. How is staff kind of taken to that? How have probationers taken to that?
Good question. We basically just leveraged the platform, the technology platform that we already had in existence. Staff embraced it just as they had before. They saw it as a great opportunity to continue. We made notification to those that were under our supervision about that, but we have found some really interesting things. We wear body cameras, and typically before we had body cameras, our average time spent with an individual under supervision was about 5 minutes on face-to-face field contacts. That time increased as we started core correctional practices and enhanced supervision program, and we could time it and video interactions through technology, through the body cameras, and it increased to roughly about 10 minutes. Here's the interesting thing we're finding. Through video conferencing and video field contacts, on average, our average interaction with these individuals has been about 24 minutes. So
wow,
you have
great.
come close. You have come close, almost tripling the time. And as we all know, time is everything. We all have large caseloads. We have a finite amount of time. We're worried about getting to the next contact instead of perhaps taking the time needed with that one contact. But it was really reassuring. And all of these can be recorded as well and uploaded into the case notes. And one thing we are just as a matter of fact, Marcus Hodges and I were on a conversation on the call last week, and he actually gave me the idea of a pulse survey. So we are now sending out surveys to those, the supervisees, the offenders under supervision, and we're asking them about their feelings for this video interaction. Are you comfortable with it? Do you feel that you've been engaged with your officer? Do you feel you've been more engaged? And so we're hoping to get those back within the next 2 to 4 weeks, just as an indicator. And right now, we're probably going to look to incorporate more video contacts as a form of supervision. But we want to see the impact on those that we are supervising. So again, I think it's always, I look at every challenge as an opportunity, and I think this is a true opportunity to really look at the way we're delivering business.
Yeah, no, it sounds like you guys have hit the ground running. What kind of core correctional practices program do you use?
This is one we launched on it about 2 years ago, and it's really about a 5-year undertaking. but it was actually we called it Enhanced Supervision Program, but it was a Dr. Lowenkamp. It's
Sure.
it's very similar to most of the core correctional practices in community supervision. Cognitive based communication, those type things. It's really been excellent for us. There's no doubt. And again, you got to have time to be able to do that, to do it effectively. And this is really given us an opportunity to do that more so than the previous supervision model.
Yeah, no, that's great. What kind of case management software do you use?
Well, it is in-house. We started when our agency was formed. We were on the Google Gov platform. It was built in-house, but it is web-based application. So that's what makes it so easy and so portable. We utilize a portal. It can be an outward-facing portal that we're about to launch for the offenders to actually interact with it, but it's also another portal where stakeholders can come into our system, whether it be corrections, whether it be parole through release decision making, whether it be substance abuse providers. So it is a web-based portal platform, and again, officers work off of Chromebooks and smartphones, and everything is uploaded and stored in the cloud.
Yeah, no, it sounds like a great kind of infrastructure you have in place for folks to work day to day in normal circumstances, but probably even providing far more return on investment for the state of Georgia these days under these particular circumstances.
Yeah, absolutely. And when I mentioned about going virtual, we really we don't even work a standard Monday through Friday 8 to 4:30. Our officers manage their hours. They manage the days they're going to work. We all know that supervision is not Monday through Friday 8 to 4:30 anymore.
Nope.
And by changing that and continuing to distance ourselves away from that fortress probation, it's actually increased staff morale because now they've got control and flexibility with their schedule as well.
Yeah, no, I think some autonomy probably goes a long way. And
absolutely.
ultimately, who knows the case is better than them, right?
That's exactly right.
Yeah. How has programming been, affected around the state for you all?
Yeah. Well, and that was a challenge because we knew that we had counseling sessions, we had groups, whether it was MRT, whether it's thinking for a change, whatever it was being delivered, courses was face-to-face and in a group setting. So that was a challenge, and our governor basically pushed to have those rules suspended where you had to get certified to do telecounseling. And so we were allowed to get all of our counselors that we utilize, run them through a very quick telecounseling program, and then start delivering that model. And we just started delivering that initially about 3 weeks ago. And we're waiting to see how well received that is. We operate also 35-day reporting centers. So you can understand, and these are high-risk population. These are folks that high chronic substance abusers. This is not a group that needs to go left unattended, and certainly during more stressful times like this. So it was imperative that we got on that right away. Thus far, the telecounseling is working. It seems to be working. And the reason I say it seems is simply we don't have any evidence at this point. It's been too soon. But once we did start it, it seems to be going well. And that, too, is something that we will probably start looking at more, especially in our rural areas where you have transportation issues, is the delivery of telecounseling. I think that's going to be an add for us, without a doubt.
Yeah, no, it's funny. Something quite similar here in Massachusetts, too, where we're not quite as big as Georgia population-wise or geographically for that matter, but we've got about 20 day reporting centers across our state. And same thing, we found that they've been, they've transitioned to, kind of telecounseling, and still kind of too early to tell, but, early engagement numbers look pretty good, which is promising. And, for us, we've got some rural parts of the state, and we also have some just, we have a couple of islands, Nantucket and Martha's Vineyard, which, are challenging to get to sometimes. So I think we could, very much take the same lessons maybe you all have on our end too, to say, oh, well, this is something we weren't really doing previously, but this seems to be working.
And
may help us kind of adapt.
Yeah, and I think this is a very, very serious situation. There's no doubt about it. But it's kind of cool that it has forced us, because otherwise I'm not so sure we would have been doing this. So it's kind of forced us to look at it sometimes out of necessity. It could very well, at the end of the day, we see good things coming out, and we're able to deliver a more effective model. The thing I think we've got to be responsible for as practitioners, we've got to make sure we're capturing this. That is one thing we did with our research unit is from day one, we went into phase one of our operation. We are snapshotting all the way up until we get back to a sense of normalcy to begin tracking this, because that's going to be the telltale sign. And I can't stress that enough, is that now is when you want to pay even closer attention to tracking the data and tracking those individuals under supervision during this time, because that's really going to be what proves whether or not this worked and whether or not this will continue to be effective going forward.
No, yeah, absolutely. It's funny though. I mean, you talked a little bit about, networks prior, and I think we've all been kind of having, conversations with each other, around the country and locally. And, I think a lot of our anecdotal impressions are very similar across the board.
Yeah.
And, as tough as this time is, and it continues to be for everybody, I think all of us kind of nerds, are kind of excited in some ways too, because it's forced us to change some things. We're learning some new things, and hopefully, like you talk about the data, like over the span of time, there may be some really valuable things we learn and can, really help to improve operations, across the sphere of community corrections going forward.
And I think it'll be cool at the end when maybe a year from now or 2 years from now, we're all coming together talking about what didn't work and what did work and what worked really well. Yeah. And I think that's there's a great potential for our profession to move forward in even a more effective and efficient manner.
Yeah, no, absolutely. You also touched on, I think a really good example of, how we've all got to be agile. And, you talked about how you had a transition to, telecounseling for your day reporting centers, and how that took some intervention from the governor in Georgia. Networks are clearly very important to operating for all of our organizations. And I think really impressive on your part that, clearly you understand governance networks and, how to take some action so that, you could fulfill your mission from your organization. Tell us a little bit about that process of figuring out, okay, we've got to do telecounseling. We need the governor to sign off on this. How did you kind of put your governance network into play and manage through that process?
Yeah, I tell you, we kind of rode the coattails. To be honest with you, I certainly don't want to take credit if I didn't have anything to do with it. But what we were advantageous at doing is doctors are in the same situation. Private counselors are in the same situation. Our batterer intervention programs were in the same situation. So it wasn't necessarily just us. It was all these others. And so you reach out to those groups, behavioral health, and you don't necessarily need to jump on the train per se. You certainly don't need to drive it because you've got other groups. If you have a good solid network with those other groups, you can see opportunities for your own. And so, and that's the way we looked at it. Look, if other places are delivering counseling like this, let's look at the executive order and do we fit this? And fortunately, we did. Now, if we would not have fit it, that's when you do go and you kind of leverage your power curve and try to influence and say, we need to be included in this and this is why. But we were truly blessed to have some forward-thinking leadership in the governor's office and as well as the legislature where we kind of fell into that umbrella. So we were very fortunate that way.
Yeah, no, that's good. I mean, and it is funny, sometimes you do need to kind of leverage that power curve in your network to get stuff done. But then other times, like this example, you still have that network you plug into, and sometimes it's a little bit easier, which is always nicer when it is easier and it works out. How is your staff doing, with kind of levels of anxiety or apprehension around COVID-19?
Yeah, well, I think they're doing well. And I'll share with you one thing we do. I know with the executive management team, we have two staff calls a week. One is focused on operations, and the other one is focusing solely on pandemic-related issues. Again, the over-communication. I actually started, it may sound hokey, but a One-Take Wednesday message that I do from my home. And I call it One-Take Wednesday because that's the only opportunity I'm going to get is one take. And I'm my own producer and editor, and I ask them for forgiveness up front. But every week, just communicating with them, folks want to know, number one, at least you have a plan or developing a plan and are actually utilizing that plan and what the plan is. And we want to make sure folks understand that. We sent out, much like we do with all of our policies, an acknowledgement where you read the policy, click that you acknowledge it. We did the same thing with COVID, understanding all the CDC guidelines, understanding going forward what this is. We had to think of implications. We had to shut one office down because there were 14 officers that were exposed to assistant DA that had tested positive. So, of course, they've got to go into quarantine, and we literally just had to close that office down for 14 days. It was a little bit longer than 14 days to make sure they were in the clear. You got to be cognizant of the fact you've got staff impacted by it that are testing positive for it, and most of the times not in relation to their work, but folks want to know that that's being dealt with effectively and being handled effectively. And then when we do return to work, they need to feel safe. They need to know that there are guidelines providing them with face masks, providing thermometers at every site, and every individual has their temperature taken 2 times during the time they are in there, requiring the wearing a mask in situations where social distancing perhaps is not possible. So the field contacts, all of those are important. Folks have to know what the plan is, and they have to know they're safe, and they've got to hear that. They've got to hear it. They've got to see it, not just read about it. And you've got to address the fears and anxieties. I think as a leader, I have to also address those fears and anxieties. Tragic situation. we had a staff member that lost his wife, not COVID related, but to understand that now this staff member has to bury his wife, and in this set of times where social distancing. I mean, it's all kind of unique challenges like that. And we've had staff that have lost family members due to this. So I think operations is one thing. The human element of all of this is a totally different approach. And folks have to know that number one, their safety is first and foremost, and that you're caring for them, you're looking out for them. And more importantly, we're all in it together. And at the end of the day, we're going to get through it. And you just, now is not the time to not over communicate.
Yeah, no, for sure. Communication is so important now. But yeah, I mean, it sounds like you're taking a really good approach in, making people or helping people feel secure, and communicating and taking time to kind of get them settled into the operational realm, but also paying attention to, just the pure human, elements of it all too, which I know it's a lot for everybody. Everybody, I'm sure, has, some experiences personally, and, it certainly affects all of us. And, I mean, it's a nice thing that you are doing your one take Wednesdays. So
I've been told I've got the perfect face for radio. Now I don't know what that means, but
you and me both. So did you ever think you would know so much about contact tracing or supply chains for PPE? If we talked about this back in January. It's almost unbelievable. And I look back and it's like, wow, this is just like 2 months ago. 2 months ago. Yeah.
And it's on one hand, it can be overwhelming, but on the other hand, it really does make you feel good to see, especially in our profession, how folks have come together to continue operations and to continue to make it better. And that's one of the gratifying things, is to see just in 2 months' time how much work has been done in our profession for something that no one ever planned on, nor could they have ever planned on. And that, I think that speaks to the professionalism of our profession. I also think it speaks definitely to why people come into this field, and that's at the end of the day, to help people and to leave things in better shape and leave individuals in better shape. And so I'm not surprised to see the folks stepping up throughout the nation in our profession. It doesn't surprise me, but it certainly does gratify me to see that, without a doubt.
Yeah, absolutely. I think, I share the very same sentiment that, I know we've got about 2,000 employees here in Massachusetts across the state. And it's just been so amazing. Just really so proud of how folks have responded, both here and then talking to colleagues around the country too. Really just does, kind of reaffirm all the things we kind of already knew, I feel like, or felt. But, certainly I think folks are motivated to get into this work, like you said, to try to help people. And,
right.
It's nice that, in both of our kind of homes, in both of our agencies and around the country, folks are finding a way to still meet their mission, while keeping each other safe too, and learning a whole lot in the, in the process. So,
absolutely.
Yeah, it's been nice. And it's been nice to have such supportive colleagues around the country. And hopefully if, somebody's listening to this too, they, can take heart in it, that they are, certainly not going through this alone. And, give a colleague a call if, they have any questions or need any help, or, can't find PPE or need some supply chains or anything
Yep.
like that.
Absolutely.
Yeah. What are you doing personally to stay sane?
Uh, I joked with somebody the other day. I said, when this all started, my wife was passive aggressive. Now she's just gone to aggressive. I think you can't take care of other people if you can't take care of yourself. You don't jump in the water trying to save somebody from drowning if you don't know how to swim. And so I think just staying mindful at the end of the day, looking at the positives, it can be extremely overwhelming, but I truly believe you've got to take care of yourself physically, spiritually, and mentally. And if you don't hit those three areas as a leader, you're going to be less effective to those that you're trying to lead. So that's really what I try to do. It seems to be working, and hopefully it'll continue to work. But that's my pretty simple approach.
Yeah, no, I mean it's simple, but it's not all that simple. So I think taking care of those things definitely, must help you stay grounded for your own team. So I'm sure they appreciate it too. Great. Well, I want to thank you for your time. I know you're busy. I think, it was a good conversation, a lot of valuable things from your end. I think that, we could all take away and learn from. And, certainly thank you for your service in Georgia, but also to the National Association of Probation Executives. I know you're a very valued colleague to us all. So thank you. Appreciate it.
Well, Brian, thank you, and I think it just says that we're stronger when we're together. So I certainly appreciate you reaching out, and I'm here, and I certainly appreciate all my colleagues that are there for me. So thank you so much for the opportunity.
Yeah, no, absolutely. Stay safe, and let's keep in touch.
Likewise. Thank you, sir. Bye-bye.
You're welcome.